Thanks for inviting me to join the UC Berkeley Great Smoke Out video program, teaching program. My name is Teh-Wei Hu, Professor Emeritus of Health Economics at UC Berkeley School of Public Health. One of my research interests has been on the economics of tobacco control. When I say economics, meaning that how we're going to raise the tax on cigarettes and to reduce smoking prevalence rate. So why tobacco control? Well, the tobacco smoking, cigarette smoking, is one single most important cause of preventive diseases, such as lung cancer, heart disease, oral cancer, and many other illnesses. As a result of that, we have premature deaths. For instance, in the United States, on the average, we have about 400,000 premature deaths in a year. And in California, we have about 40,000. Now, as in China, that because of 1.3 billion population, and so yearly about 1 million premature deaths in China. So the question of smoking control, that is tobacco control, is not only the health issue, but also the economics issue. Because that when you smoke, premature death and illness will result in healthcare expenditures. Again, like in the United States, we're talking about $300 billion that the loss of society due to the medical care cost and the loss of productivity. And in California, we have about $30 billion, about 10%. In China, well, because of foreign exchange differences and lower cost of healthcare, but still about $60 billion of healthcare costs. Now, the question is that when you increase the cost, it's going to have effect not only to the person a smoker who will have illness, but also increase the overall health expenditures, health insurance premium increase, and the government expenditure increase, Medicare, Medicaid. So it end up a lot of people, including non-smokers, also paying the cost. So not only this, it's a public health issue because the smoking is not only hurting your own health, but also help the secondhand smoke. Sometimes we even have called the third-hand smoke. So those individuals that, especially like women, a pregnant mother, who inhale those nicotine will affect the babies, birth defect, and also they got also effect on the illness. So that means that the smoking, the tobacco control is not only a personal health issue, but also the public health issue. So then the question is, how are we going to deal with this public health problem? Well, there are two ways to do it. One is that we call the price control. That means that we're going to raise the price of cigarette through increased taxation, and then it will hurt people's pocket. So people see more expensive, so therefore buy less. And for the young teenagers, high school students, because they have less incomes, so they end up maybe not initiate smoking, okay, or quit smoking. So that has one kind of a very effective way to try to get people to deter smoking. The other we call the non-price control, and that is, let's say, smoke-free in the public place. You're not allowed to smoke in the railroad station, airport, hospital, restaurant, and also another scheme is that we have a warning label. So the cigarette package has some kind of alarming, distasteful effect for the people who try to initiate smoking. And then also there is a media campaign that we want to against smoking. So those kind of called non-price control. So just like at Berkeley, that we call the smoke-free campus. It's one of the 1,000, about one of 1,000 campuses across the United States. Berkeley started in 2014 on this. And so it's supposed not to smoke, not only not to smoke cigarette, but also e-cigarette, many other products. Now, the these kind of control, tobacco control, it's very difficult to implement, especially raising tax. Why? Because that the tobacco industry is one of the major players that in the economy. So in the United States, for instance, that those lobbyists on behalf of the tobacco industry, they were against raising taxes. They were raised against the ordinance of that. Now in China, particularly, is more difficult. I've been working in China for about 25 years, try to convince the Chinese government to raise the taxation. In China, the tobacco industry is part of a government. So it's a government monopoly. So for them, it's like a conflict of interest. They do not want to defeat their own purpose, try to increase the market. And also because they think that economics is more important than health for some of the officials in Chinese government. Now this is also true even in Indonesia or in the United States, that when tobacco industry is strong and we have more difficult to face this tobacco control. For instance, in California, we do not have a tobacco industry. So it's easier for California to raise a tax. So California has a tax of $2.85 per pack. And we before was 85 cents, 2 years ago raised to $2. Now, because there's no tobacco industry here, no tobacco farming here, but if you go to North Carolina, Kentucky, well, those states, their tax rate on cigarette is only maybe 50 cents, 20 cents, because they have tobacco industry, the farmers, and in other countries as well, like Indonesia, they have tobacco farmers and they have tobacco industry, so therefore it's more challenging to do it. Now coming back to California, that California is the first state in the country, 30 years ago, 1989, 88, the first state to raise the tax on cigarette, and not only raise the tax on cigarette, but also use this money to help the people to pay for healthcare expenditures and to improve the environment. And so those kind of first initiative in the country have been adopted by many other states and also other countries like Taiwan and also European country as well. So now in California, that the smoking prevalence rate from that time was 1989 was about 22% from adult, which is about 1 out of 5 adult smokers. Right now, it's about 11%, so 1 out of 10. So you see the difference of the changes. But it takes a lot of time, not only because of taxation, because of what we call the non-smoking price. Now, why California is so successful? Because we call it the social norm, that if you're in Berkeley, in San Francisco, in LA, smokers, they feel uncomfortable, they feel awkward to smoke in front of you. So this has a very important effect. And so this smoke-free in a public place is a very important scheme in addition of the raising the taxation. And so in China, for instance, that they started late. They started in about the year 2008. And they joined the WHO program. And the first time they joined, again, they do not want to raise tax at all. What they want to do is try to start smoke-free. And because in China, about 50% of male are smokers. And women smokers very low, only about 3%. So you can see that man has a very important share of the smoking in the society. But then, in many instances, that the men are also in the leaders, in the political leader. So therefore, their concern is political issue, economic issue, and health issue is the bottom, is a lower level of the concern. However, if you have been in China, you can see the difference in the last 10 years. That in the smoking-free places, you see that still they have restaurants. Some restaurants decided not to have smoking, or they only have an area to smoke, and also the reduction of smoking in many other public places. It varies. China is such a large country, so therefore, if you go to Shanghai and Beijing, Guangzhou, it's much better. If you go to a rural area, Henan, Xinjiang, well, it's different. Just like in California. See, California is very, very concerned about smoke-free. But if you go to Chicago, go to East Coast city, you feel uncomfortable. There's still a lot of smoke around here. So I think the important part of the message we have here that it's a national trend, it's the local trend, but also it's international trend. Through the effort of WHO, that they try to convince the government, number one, to raise tax on cigarette and then make it more expensive for smokers, and therefore they will reduce smoking prevalence rate. Number two, they will start on many of the non-smoking, non-price control program. And we have seen the results across the United States, around the world. And so I'm hopeful that work we should be able to, it takes a long time, but I think this is a very important number one public health issue. Thank you.
All right, Professor Hu, in your talk you mentioned the concept of the social norm and how people feel uncomfortable smoking in front of other people. How do you think we could establish that social norm on campus here?
Okay, so I think that number one is the regulation. I'm not sure how much of the California, the UC campus system, although years ago I saw the signs of the "We are a smoke-free campus," but I have not seen signs lately. So one thing we need to do is to make students aware that smoke is not allowed. It's not good for your health. That's number one. And number two, I think that we need to mobilize more conversation. Workshop, and also alert some of the public health expert to talk about and also make students aware that smoking there's no benefit to you at all. Unlike other, even like alcohol, wine is some good things for you, right? Candy is chocolate is good for you, but smoking has no benefit at all. So I think the social norm is that you, number one, to express the harmfulness to your colleagues and so on. And furthermore, if one can be more proactive, even like in China right now, in the park, in the campus here, if somebody is smoking, you can say gently to remind them, hey, by the way, do you know that we are a smoke-free campus here? And so it may help people.
All right.
So the media campaign is not only that in terms of the posters, but also like Cal Daily. Why don't we have a section, a forum on this once a while, or maybe advertisement on this, and mention about the harmfulness of the cigarette product, especially e-cigarette right now. It's become a fashion. E-cigarette is really, I think, is the gateway toward the cigarette smoking. Now, cigarette smoking is the gateway to substance abuse. So we do not want to allow it from one individual to start from the other.
So kind of related to that question, a lot of the UC Berkeley students here smoke because their peers smoke and they want to smoke because of this social pressure. How do you think we could maybe try to prevent our decision-making process from getting influenced by all these social pressure and peer pressure?
Yeah, I think the peer pressure is a very important one, especially for students. So I think that it is important to break up this peer pressure. So somebody, as a friend, it's a communication, but the way is how you're going to express a nice way to share them. Say, look, if you invite me, say, hey, Bob, how about I have a cigarette? In China especially, cigarette we call the medium of exchange of friendship. So even I do not know you, I say, hey, the way of showing this cigarette, share the cigarette, getting very close. So I think those kind of gesture is not very helpful. So if we can mobilize, have those kind of activities, try to show, but it takes courage, okay? But it takes skill, the personal skill to do it. And it's not pleasant, but I think for individuals' health, you want to think about you're doing them a favor. So if you think that way, that might be helpful. And you may also have counseling. You invite a group of the smokers, and you invite somebody who were ex-smokers, and share them how they quit smoke, and how the benefit of quitting. The benefit of quitting is not only improve your health, but also you get more pocket money. You can buy other things, right? So I think the communication, the knowledge, information, I think that it will be useful to share with colleagues.
So the last question I have for you is that Berkeley is known for its political activism. What role do you think Berkeley students should play and can play in the grand scheme of this anti-tobacco campaign across California and the entire nation?
Well, you're right. You know, California is the frontier of many political and social agendas, including the California tobacco taxation. I was saying 30 years ago, we started the first state, then Arizona, Oregon, and then New York, and then New Michigan that followed. Right? So I think the fact that UC Berkeley campus is a really good starting point. We're the frontier, even within this UC campus here. And I think probably what you could do, there are a couple of things. One, that in the UC system, there is called a tobacco research office within the UC president office. And they got a lot of funding because of the raising the tax of cigarette. So they got last year they got a 1.6 billion tax revenue. And one of the agenda is try to allocate the funding to do, many of them do research. Okay? And I do not see much of the activities of allocate the resources to remind the faculty, remind the student across the campus. So I'm just thinking loud. I think that one thing you could do is contact the director of the UC system Tobacco Control Research Office. His name called Bar. So it's, I'm sure that they will be able to, they'll be delighted to talk with you about how we can mobilize not only Berkeley, but also UC system. I think your group here can take the leadership to do it, and this is a very good cause. You know, it's sadly to say that I've been doing research for 30 years, and the only thing I saw was 2014, saw the sign, but I don't see any other things. But I still do not know, for instance, what's the smoking permit within the campus? Do you have an idea?
No.
Yeah. So I think the first thing you want to do, okay, maybe to initiate a random sampling to find out among the UC Berkeley campus, what's the percent of students smokers? Okay. And what percent of students who are e-cigarette smokers or other products? Okay. And maybe you can apply for funding through that office. TRDRP, called TRDRP, Tobacco Research Control Program. I can send you an email and the name of the director. I think that this would be a good way for them to, you know, start from California, and the money is the house, the UC Berkeley, not UC Berkeley, but campus, president office in Oakland. So I think you might want to send me an email and talk about your initiative to do that. You get some small funding, you know, and mobilize your group, and not only students from China, students from Latin America, students from Africa, and so many countries. The African countries is a different story. they're the tobacco farmers, because in the U.S. now reducing the tobacco growing, and so the end of the tobacco farming is doing in Africa. It's cheaper, labor is cheaper, right? Weather is nice there, so the product's cheaper. So therefore, the end of the tobacco farmers, they also the women farmers, they got inhaled all this fume and the tobacco leaf curing, you know, and so it is also a major issue there. It's not only the smoking issue, but also the economic issue and the human rights issue. So my suggestion is that contact UC System Tobacco Control Research Office and get a small grant and start on the research on survey of smoking, not only the cigarette and e-cigarette and other products, and even marijuana, you know, because this is another thing that's in California. And this will give you the base. Like I've said in many other occasions there, when you want to initiate a program, you want to have a data. And you can have a figure to speak. And then you get to, it also help you to do your own research, your academic term paper, and for the agenda, it's for good cause. It's a win-win agenda for you.
All right. Thank you so much for joining me with us today. I think that's the end of my questions.
Okay, yeah.